The podcast opens with a powerful discussion on the long-standing neglect of women's health in medical research and funding. Despite women constituting a majority of the population and making the vast majority of healthcare decisions, less than 1% of research funding is allocated to women over 40. This disparity has profound implications, from delayed diagnoses of female-specific diseases like endometriosis and PCOS to inadequate treatment protocols that overlook critical differences in female physiology. The guests underscore that this institutional barrier stems largely from historical biases, where medical studies relied almost exclusively on male physiology as the norm, leaving women's unique biology as an understudied afterthought. The panel highlights that women do not merely live longer than men, they experience longer periods of poor health, including a disproportionate share of chronic diseases, mental health disorders, and frailty. Female-specific conditions often take years to diagnose, leaving countless women in chronic pain or hormonal imbalance without proper care. The experts call for urgent shifts in research paradigms and healthcare education to account for women's physiological complexity, emphasizing that these gaps contribute to misdiagnosis and systemic dismissal of female symptoms. A significant portion of the conversation delves into the biological distinctions between men and women that necessitate tailored research and treatment approaches. From cellular responses to systemic functions, women's bodies exhibit unique features. Women tend to have more endurance muscle fibers, different bone density patterns, smaller hearts and lungs, and distinct hormonal cycles that influence metabolism and how they respond to stress and exercise. These differences extend beyond reproductive organs to every tissue in the female body, including the brain, bones, gut, and cardiovascular system. These inherent differences explain not only the variation in disease presentation, such as heart attacks manifesting differently in women versus men, but also why women's fluctuating hormone levels throughout the menstrual cycle can dramatically alter physiological responses. The experts stress that lumping female health into generalized data derived from male-focused studies obscures these nuances and perpetuates suboptimal care and misinterpretation of symptoms. The podcast lays out a comprehensive picture of the menstrual cycle as a vital marker of overall health, transcending its reproductive role. The cycle's hormonal fluxes, involving estrogen, progesterone, luteinizing hormone, and follicle-stimulating hormone, influence not only fertility but also brain health, immune function, metabolism, and physical performance. The panel explains that the first half of the cycle, dominated by rising estrogen, primes the body for ovulation, while the second half, or luteal phase, is progesterone-rich and prepares the uterus for a potential pregnancy. The experts caution against misconceptions about irregular or absent periods, underscoring that consistent irregularity often signals underlying health issues such as hormonal imbalances and metabolic disturbances. They emphasize that tracking ovulation and cycle phases is crucial not only for fertility but also for understanding hormonal health, especially given the widespread use of contraceptives that obscure natural cycles today. Importantly, they stress that skipping periods, whether through lifestyle factors or medical interventions, can have long-term consequences, including bone density loss, mental health challenges, and impaired metabolic function. An irregular or absent menstrual cycle is not trivial. The panel insists it is a red flag for systemic health problems. When a woman consistently cannot predict her period or experiences cycles shorter or longer than the typical 25 to 35 days, it often indicates hormonal dysfunction or metabolic disruption, which may compromise fertility and overall well-being. This irregularity can stem from conditions such as polycystic ovarian syndrome, PCOS, hypothalamic amenorrhea, or chronic stress. Notably, women who suppress their periods through hormonal contraceptives or suffer from chronic energy deficits due to fasting or overtraining often experience hypoestrogenism, a state harmful to bones, brain, and cardiovascular health. The experts warn many women unknowingly normalize or even celebrate missed periods without understanding these underlying risks. They advocate for better education on menstrual health as a whole-body health indicator and urge women to seek assessment whenever cycles become unpredictable. PCOS emerges as one of the most prevalent and misunderstood contributors to menstrual irregularity and infertility. The conversation reveals that PCOS is not primarily an ovarian issue, but largely a metabolic disorder characterized by insulin resistance and chronic inflammation, which disrupts the hormonal signaling needed for ovulation. The experts explain how insulin causes excessive androgen production and ovarian cyst formation, interfering with normal egg release and hormonal balance. Importantly, while PCOS is genetic and thus not caused by lifestyle, women can influence its severity through diet, exercise, and stress management. The guests describe how a plant-forward whole food diet rich in fiber and low in ultra-processed foods, combined with controlled stress and appropriate exercise, can reduce insulin resistance and inflammation, improving menstrual regularity and fertility outcomes. They stress that starvation or excessive exercise backfires by increasing stress hormones that worsen hormonal dysfunction in PCOS. The podcast acknowledges endometriosis as a chronic inflammatory disease, severely underdiagnosed due to dismissive attitudes toward women's pain and lack of public awareness. The panel describes the inflammatory implants of endometrial tissue outside the uterus, causing excruciating pain, organ scarring, adhesions, and significant fertility challenges. Diagnosis often takes 7 to 10 years and usually requires surgery, as imaging techniques remain imperfect. Living with endometriosis means navigating systemic inflammation, chronic pain, and complex fertility decisions often made under duress. Current treatments, primarily hormonal suppression via birth control, provide symptomatic relief but do not cure the disease or restore fertility. The experts call for greater research investment and innovative interventions, including lifestyle factors such as anti-inflammatory diets, sleep optimization, stress reduction, and emerging therapies like cold water exposure to help dampen inflammation and improve quality of life. Hormonal contraceptives receive nuanced discussion, highlighting their dual role in regulating periods and controlling fertility, but also profoundly altering natural hormonal rhythms. By suppressing ovulation, contraceptives stop the cyclical production of natural estrogen, progesterone, and testosterone, which impacts physical and mental health parameters, including bone density, libido, mood, and metabolic function. The panel conveys caution about contraceptive options like progesterone-only IUDs and implants, which can suppress ovulation and estrogen production for extended periods without women realizing the systemic health impacts. They advocate for comprehensive education so women can make truly informed choices about contraception relative to their life stage, goals, and athletic or performance demands. The conversation challenges the oversimplified, all good or all bad narrative surrounding birth control pills, emphasizing personalized decision-making grounded in full knowledge of benefits and risks. The topic of fertility underscores critical lessons about egg quantity and quality over a woman's lifespan. While women are born with all their eggs, numbers diminish sharply from fetal life to puberty and continue gradually thereafter. More importantly, egg quality declines with age, especially after 30, due to chromosomal and metabolic damage that contributes to reduced fertility and increased miscarriage risk. Men's fertility, producing millions of new sperm daily, remains more resilient over time, but is still vulnerable to lifestyle factors like smoking and marijuana use. Given societal trends to delay childbearing and the biological realities of ovarian aging, the experts advocate earlier awareness and proactive management of fertility goals, including the option of egg freezing in the late 20s or early 30s. However, cost and access remain significant barriers. Fertility is portrayed as a multifactorial health dimension linked to lifestyle, hormonal wellness, and environmental exposures, rather than mere luck, and the dialogue encourages open, destigmatized conversations about reproductive planning. Perimenopause, the often misunderstood transitional phase before true menopause, is examined with a focus on its erratic hormonal signaling and symptoms beyond the classic hot flashes. Perimenopause begins years before menstruation ceases, characterized by diminished ovarian responsiveness and fluctuating estrogen and progesterone levels. This phase is typified by disrupted sleep, mood changes, brain fog, and reduced stress resilience, often causing women to not feel like themselves despite still having regular periods. The experts strongly critique the outdated medical definition of menopause as a diagnosis made only after 12 months without a period, arguing this delays appropriate care and exacerbates symptoms during a vulnerable hormonal upheaval. They propose earlier recognition and support for women traversing this transition, emphasizing that many suffer needlessly due to systemic ignorance and stigma around hormonal therapies. The emotional and identity shifts accompanying this phase also demand more compassionate attention in healthcare and society. Hormone replacement emerges as a cornerstone of managing perimenopausal and menopausal symptoms, yet uptake remains low due to persistent fears, misinformation, and cultural stigma. The panel discusses the benefits of using individualized, often transdermal, hormone therapies that restore estrogen and progesterone levels to stabilize mood, cognition, bone health, and cardiovascular function without suppressing ovulation in perimenopausal women. Testosterone supplementation is also acknowledged for its positive effects on libido, energy, and muscle preservation in some cases. Despite solid evidence supporting HRT's safety and efficacy, only a small minority of eligible women receive or choose it, a situation partly rooted in outdated guidelines and fear from early flawed studies. The experts emphasize that while HRT may cause some side effects, such as mild bleeding or headaches, these are minor compared to untreated estrogen deficiency's risks. They strongly encourage women to make informed, personalized decisions rather than avoid therapy out of fear or stigma. The podcast moves into the intimate realm, exploring how hormonal shifts affect sexual desire, function, and relationships during perimenopause and beyond. The experts note that declining estrogen not only dampens libido, but also leads to physiological changes like vaginal dryness and tissue thinning, which can make intercourse painful or uncomfortable. Unfortunately, many women and their male partners remain unaware of these changes, leading to misunderstandings, feelings of rejection, and reduced intimacy. Local vaginal estrogen therapies emerge as effective, low-risk treatments to restore tissue health and improve sexual comfort, alongside systemic hormone therapy that may enhance desire. The guests stress that open communication, education, and appropriate medical interventions can improve intimacy and relationships. Additionally, menopause is framed not only as a biological challenge, but as a time of empowerment for many women who recalibrate emotional boundaries, shed unhealthy connections, and embrace authentic self-expression, leading to renewed confidence and fulfilled relationships. Finally, the panel turns to broader social implications, advocating for systemic changes in workplace policies to accommodate women's unique health needs, especially during menstrual cycles, fertility challenges, pregnancy loss, and menopause. Flexibility, paid leave, access to childcare, and menstrual or menopause leave are highlighted as critical supports that can improve productivity and loyalty while respecting women's lived experiences. They argue that the traditional rigid 9-to-5 work model does not accommodate the hormonal fluctuations and health demands that many women face. Employers offering adaptable schedules and understanding are not just being compassionate, they are fostering inclusive environments where women can thrive professionally and personally. The guests also call for destigmatization around pregnancy loss and hormonal health conversations to allow women grace and agency in navigating these often isolating and challenging transitions.